Thank you for the opportunity to present our second study here. This is on the early diagnosis of lung cancer among younger versus older adults. We have no disclosures related to this presentation. Over the last decade, studies have shown that there have been significant improvements in the early diagnosis and survival of older U.S. adults diagnosed with lung cancer. However, these studies have not evaluated trends in early diagnosis and survival among young adults diagnosed with lung cancer. Previous studies have shown that young adults diagnosed with lung cancer have distinct tumor characteristics and survival compared to older adults diagnosed with lung cancer. It's unknown whether recent improvements in early diagnosis and survival among older adults diagnosed with lung cancer are also observed among young adults diagnosed with lung cancer. The objective of the study was to examine changes in the stage of lung cancer diagnosed and survival of younger and older patients diagnosed with lung cancer in the United States since the introduction of lung cancer screening. We hypothesized that over the last decade, improvements in early diagnosis and survival of older adults diagnosed with lung cancer do not extend to young adults diagnosed with lung cancer. We queried data from the United States Cancer Statistics Database to assess the incidence of non-small cell lung cancer by age group. In addition, we queried data from the National Cancer Database to evaluate changes in the stage of lung cancer diagnosed and survival of patients by age group. We included patients aged 20 to 79 diagnosed with non-small cell lung cancer in the United States from 2010 to 2018. We examined changes in the stage of lung cancer diagnosed from 2010 to 2018 for different age groups using multivariable ordinal logistic regression. In addition, we assessed 5-year overall survival for different age groups. We also evaluated changes in median overall survival from 2010 to 2018 for different age groups. This graph shows the number of patients diagnosed with non-small cell lung cancer in the United States by age group from 2010 to 2018. Of note, for the age group of 20 to 29 years old, there were 1,328 patients with lung cancer. For the age group of 30 to 39, there were 5,682 patients with lung cancer. And for the age group of 40 to 49, there were 39,323 patients with lung cancer. This figure shows the breakdown of tumors by histologic subtype for each age group. Carcinoid histology comprised a significantly larger proportion of lung cancers among younger age groups, with 58% and 29% of patients aged 20 to 29, 30 to 39 diagnosed with carcinoid tumors compared to 4% of 70 to 79-year-olds. Adenocarcinoma and squamous cell carcinoma comprised the majority of other lung cancers diagnosed in each age group. Only a small percentage of lung cancers were large cell carcinoma and adenosquamous cell carcinoma in each group. In subsequent analyses, we focused on adenocarcinoma, squamous cell, large cell, and adenosquamous cell carcinoma. This graph shows the distribution of race by age group among patients in our study cohort. Younger patients were more likely to be Black or Asian when compared to older patients diagnosed with non-small cell lung cancer. This graph shows the percentage of patients in the study cohort diagnosed with non-small cell lung cancer who were female. About 50% of patients in each age group were female. We then examined the percentage of patients diagnosed with stage 1 and 4 non-small cell lung cancer by age group. The blue bars indicate patients diagnosed with stage 1. The orange bar indicates patients diagnosed with stage 4. Almost 80% of patients aged 20 to 29 were diagnosed with stage 4 disease, compared to 40% of patients aged 70 to 79. Similarly, only 8% of patients aged 20 to 29 were diagnosed with stage 1 disease, compared to 29% of patients aged 70 to 79. With increasing age, the percentage of patients diagnosed with stage 4 disease decreased, and the percentage of patients diagnosed with stage 1 increased. Interestingly, when we examined patients aged 80 to 89 who are ineligible for screening, this trend was no longer observed, with an increased rate of stage 4 disease and decreased rate of stage 1 disease in this age group. Next, we evaluated whether the percentage of individuals diagnosed with stage 4 lung cancer changed from 2010 versus 2018 in each age group. In this graph, the blue and orange bars represent the percentage of patients diagnosed with stage 4 disease in 2010 and 2018, respectively. The percentage of patients aged 20 to 29 and 30 to 39 diagnosed with stage 4 disease did not significantly change from 2010 versus 2018. The percentage of patients aged 40 to 49 diagnosed with stage 4 disease was higher in 2018 versus 2010. And in contrast, among patients in age groups over age 50, there was a significant shift to earlier stages of disease identified in 2018 versus 2010. This figure shows the percentage of patients diagnosed with stage 4 lung cancer from 2010 to 2018 in a younger cohort from 20 to 49 years of age and an older cohort from 50 to 79 years of age. We examined year-over-year changes in these percentages. Among patients aged 20 to 49, the percentage of lung cancers diagnosed at stage 4 increased from 60 to 64% from 2010 to 2018. In contrast, among individuals aged 50 to 79, the percentage of lung cancers diagnosed at stage 4 did not change significantly from 2010 to 2013, but then decreased by 3% from 2013 to 2018. The difference in the rate of stage 4 disease identified between the younger and older cohorts increased from 13% in 2010 to 21% in 2018. We also performed a multivariable adjusted analysis of changes in the likelihood of being diagnosed with earlier stages of disease from 2010 to 2018. The odds ratios presented in this graph represent the year-over-year change in odds of being diagnosed with earlier stages of disease. Odds ratios greater than 1 indicate a shift toward earlier stages of disease identified from 2010 to 2018. Odds ratios less than 1 indicate a shift toward later stages of disease identified from 2010 to 2018. Among patients aged 20 to 29, 30 to 39, and 40 to 49, the multivariable adjusted odds of being diagnosed with earlier stages of disease from 2010 to 2018 did not significantly change. In contrast, patients in age groups of over age 50 had a significantly greater odds of being diagnosed with earlier stages of disease in more recent years. This graph shows the 5-year overall survival of patients diagnosed with stage 1 to stage 4 by age group. Patients aged 20 to 29 diagnosed with non-small cell lung cancer had the lowest 5-year overall survival rate at 20%. Overall survival was also low at less than 30% among all other age groups evaluated. This is a similar graph looking at 5-year overall survival by age group and clinical stage group. In general, 5-year overall survival was higher among younger patients compared to older patients across all stages. However, among patients diagnosed with stage 4 disease, 5-year survival was low for all age groups at 11% for patients aged 20 to 29, 15% for patients aged 30 to 39, and 10% for patients aged 40 to 49. Next, we examined changes in median overall survival among patients aged 20 to 49 years old. From 2010 to 2013, median overall survival did not significantly increase. From 2014 to 2017, median all-cause survival did increase by 11 months. We then specifically evaluated changes in median overall survival among patients aged 20 to 49 diagnosed with stage 3 to 4 disease. There were similar increases in median overall survival among this subset of patients with late-stage disease, which likely drove the improvements in overall survival observed among the overall cohort of young patients. Notably, these improvements in median overall survival appear to align with the NCCN's recommendation for genetic testing for EGFR and ALK mutations in 2012, as well as the FDA's approval of immunotherapies in 2015. We performed a similar analysis of patients aged 50 to 79 years. Among patients aged 50 to 79, there was also a significant increase in median overall survival over the last decade. However, this improvement in survival did not appear to be driven by improvements in the survival of patients diagnosed with more advanced disease. There are several limitations to the study. First, we did not have data on whether lung cancer was screen detected. Second, there were no data regarding the receipt of targeted therapies among patients in our cohort. In addition, there are no data regarding tumor biomarkers. Lastly, we did not have data regarding differences in time from initial presentation to lung cancer diagnosis between younger and older patients. In conclusion, In this national analysis of patients diagnosed with lung cancer from 2010 to 2018, we found that over 64% of younger adults diagnosed with lung cancer continued to be identified late in their disease course. Different tumor biology, delays in diagnosis, and the absence of methods to facilitate early detection of lung cancer among young adults likely contribute to the high rate of stage 4 disease diagnosed in this population. Although there is no improvement in early diagnosis among young adults, median survival of young adults diagnosed with lung cancer increased by 14 months during the study period, largely due to improvements in survival for patients with advanced disease. However, 5-year survival of younger patients with stage 4 disease was still only 10 to 15%. These improvements in median survival observed among young adults diagnosed with lung cancer are encouraging. However, the lack of progress with regard to increasing early diagnosis among this population illustrates the need for strategies to increase the early detection of lung cancer among younger patients. Thank you.